I have been asked to explain what I can do for my patients and what I specialize in. I'm a GP and I'm also a menopause specialist, so I can explain you how to spot perimenopause, menopause, how we can prevent the complications that come with it, what are the treatments available. There are medical treatments, there are hormones, non-hormones, cognitive behavioral therapy. The symptoms, we tend to dismiss them as age-related symptoms or natural transition, but those symptoms are very debilitating and you don't have to suffer. There are many things you can do about it. Just come and talk to me. I also specialize in hair regrowth treatment. I use a product called exosomes. They're extracted from salmon. They are genetic materials which are chemical messengers. They talk to your hair follicles and they make them regrow as if they were young again. And the results are very dramatic. You can see significant changes within weeks and in about months you would definitely see a huge difference. The products are very simple to apply. We just spray them in under the scalp. The device is made tailored to deliver that service. So what to expect on your appointment? How are you supposed to be prepared for it? Please come in with a clean face, clean hair, bring all of your medication, bring your past medical history, bring a list of allergies, have a vision of what you want, why you want it, why it is important for you. If you have a timeline, please let me know because we will need to prepare it in step by step. Each stage will take some time for recovery. We'll combine the treatments so you will have a bespoke treatment to have a pretty natural product that will last you for a long time and make you happy for the rest of your life. The aim is to give you the best physical mental health by having this treatment. We can combine the pills, injectables, regenerated treatments like exosomes, polynucleotides, and the end of it is a very beautiful result that you will love forever. I work with the product called Alumiere. They are medical grade skincare products, and everything we do in clinic, it wouldn't be worth anything unless we do skincare at home. We really need to be using vitamin C for antioxidants during the day, a bit of retinol at night for skin regeneration. We need to be covering ourselves from the sun every day. Whenever there is light, there is sun. It doesn't really mean that you have to have an actual sun. The UVA and the UVB are everywhere. UVA will age you and UVB will burn your skin. So here is a little bit of fun practice between me and my friends discovering what colors our sunscreen blends are.
A little bit of vitiligo on this one, okay. So it would be good to see if it covers it, which
I think the versatile
it's blended very well.
Yeah.
But yeah.
So that's versatile tint.
That's versatile tint.
And that one is sand.
And that's the sand. I think the sand is very good.
Yeah.
And definitely there's a difference between my two hands where that got the ivory on and that's
very nice actually.
How about you try the versatile tint? I think you might like the versatile tint because because you don't necessarily like too much color in it. So whatever that blends in, probably better for you.
Oh yeah.
Yeah?
Yeah, so that looks more natural for my skin colour then, doesn't it?
Yeah, that's really good.
That's good
coverage. This one is the sand. Okay, so factor 40 again. It gives a really nice coverage. You can see.
That's a nice colour as well.
Yeah.
Okay. Does it feel like
It feels silky.
not too oily, is it?
No, it doesn't feel oily at all. And that's got good coverage. And then,
Ivory.
Yeah.
So I'm going to put some of that on this. I'll put a bit more on, but it definitely covers a little bit of the marks on my
Okay.
hand.
Yeah.
Blends in very well. And then, compared to the other, it definitely has a bit of a tint.
Yes.
So it definitely
Yes.
gives you more of a glow. Ivory.
Okay.
this one is sand. This one.
Okay. Could you like push out a little bit
So?
so we can see the color?
And
Yeah.
this one's ivory, and I've just put it on that hand
Okay.
as opposed to that hand. And so,
I do actually like the color.
yeah, so that's
Yeah.
okay. It does mask the
Yeah.
marks on the skin a bit more.
This
Yeah.
one here is the sand.
Yeah. Have you put it on?
Yeah, that's
That
almost
blends
giving a
very
little
well.
colour, isn't it?
Yeah.
That's the colour.
This one, could you like, yes.
That's
So that
this one.
that is sheer hydration, yeah?
Yeah.
That's completely clear.
Yeah, that's
And
the
that
sand.
One, that one
That's
is
the
the
sand.
sand.
And this one here is the.
Which one is the sand?
This is sand.
So here are some before and afters. So the most sought after treatments are the lips or the tear trough. The difference between the tear trough and the bag under the eye is that the tear trough issues mean that your eyes are a bit sunken and darkened. For that, we can fill it with a filler, we can use polynucleotides, we can use peptides. I advise people to always use the creams at home for the eye. The problem with the eye bags though, you can't put more filler in the eye bag. Putting more filler in the eye bag will just give you more of a bag. That will need surgery. We can correct the gummy smiles. We can get your hair to grow back. The hair growing back, you can also use platelet-rich plasma. The plasma means that your own blood is used, so no allergies. You can use it for the skin as well. It is much cheaper, less allergies, but the results are not as dramatic as exosomes. And this is our patients who have been on our weight management program called Step to Success. And these are all pretty much the results between 3 months.